So this week's topic is a dementia diagnoses. Now what? So we would like to do the land acknowledgement for Surrey, British Columbia. We would like to acknowledge that the land on which Surrey, British Columbia is situated is in the traditional territory of the Coast Salish peoples, including the Semiahmoo, Katzie, Kwikwetlam, Kwantlen, Quechua, and Tsawwassen First Nations. We recognize and respect the enduring presence and rich cultural heritage of these Indigenous nations, and we appreciate the land that we are using. All right, so we'll get right into the presentation here. So we go over this every week, but it's just to really solidify that learning. So dementia is a syndrome that's characterized by a decline in memory, language problem, or pardon me, is characterized by decline in memory, language, problem solving, and other cognitive skills that affect a person's ability to perform everyday activities. The dementia diagnosis process typically involves a medical history, a physical examination, mental status tests, and imaging tests to rule out other possible causes. Early diagnosis is important to identify reversible causes, obtain appropriate treatment, and also to plan for the future. So what is the first step when you receive a dementia diagnosis? Process it. So it's important to take some time to process the information and to understand your emotions. It can be challenging and an overwhelming experience, so it's crucial to be patient and kind to yourself. It may also be helpful to reach out to loved ones or support groups for guidance and emotional support during this time. Additionally, consulting with healthcare professionals specialized in dementia can provide valuable information about treatments and lifestyle adjustments can help manage the condition. Remember, you are not alone and there are resources to support you and assist you on this journey. Every individual's situation is unique, so the next steps and options may vary. It is essential to work closely with healthcare professionals and explore available resources to create a comprehensive plan that is tailored to your needs and your preferences. So after receiving a diagnosis of dementia from your doctor, it's important to schedule a follow-up appointment with a dementia specialist, such as a neurologist or a geriatrician. The specialist can help provide more information about your specific type of dementia, available treatments, and ways to manage symptoms. They can also connect you with support services and resources within your community. So choosing the right specialist, uh, um, look at, so there's a neurologist that specializes in disorders of the nervous system, such as Alzheimer's disease. There's also a geriatrician. They focus mainly on senior health with also issues like dementia it's got elderly, but in older patients. There's also psychiatrists. So these individuals are experienced in diagnosing and treating mental disorders like dementia. There's also dementia specialists. So these are individuals that are specifically trained to diagnose and manage dementia. So we know that consulting the right specialist is crucial for accurate diagnosis, treatment guidance, and support after receiving a dementia diagnosis. So by scheduling an appointment with a specialist, to discuss the disease and the diagnosis, it's important to understand the implications and explore potential treatment options that may come with it. It's a crucial step in understanding the condition and charting a course forward. So what does this look like? Look for a healthcare professional with expertise in dementia or neurology. Choosing the right specialist, again, ensures that you receive that accurate information and tailored guidance that fits you. Understanding the diagnosis. So it's important during the appointment, the specialist will explain the specific type of dementia that is diagnosed, such as Alzheimer's disease, vascular dementia, Lewy body, and the stage that it's in. They will provide information about how the disease progresses, its typical symptoms, and potential challenges that you and your loved ones may face. So they will use common diagnostic tools such as medical tests, such as an MRI, CT scan, and blood tests in order to aid diagnoses. And it's also a multidisciplinary approach. You want to make sure that you have a team of healthcare professionals that are supporting you. That also means allied health, such as physiotherapy, occupational therapy, and recreation therapy. So by having that accurate diagnosis, it's critical for effective dementia treatment and also care planning. So what does that assessment and that evaluation look like? So the specialist may conduct further assessments to determine an individual's cognitive and functional abilities. These assessments help in understanding the severity of the condition, tracking changes over time, and planning appropriate care strategies. So there will be a medical history review. So they'll do a full review of your history, concussions, um, what is your hormone blood levels look like. They also do cognitive testing. So the specialist will conduct tests to evaluate an individual's memory, reasoning, and communication abilities. There's also a physical exam. The specialist will do a full physical exam, also looking for any additional signs of dementia, because as we've learned, dementia can also manifest physically. They'll also order some blood tests. So they may be ordered to rule out any reversible causes of dementia, such as vitamin deficiencies. And we have spoken in the past about those mitigating risk factors that you can have a little bit of control over. So in this comprehensive assessment, the healthcare team, which may include a neurologist, a geriatrician, a psychiatrist, and other specialists, they will conduct a thorough assessment of an individual's cognitive abilities, physical health, and overall well-being. This assessment also helps to determine the stage of dementia, whether it's early, mid, or late, and the specific symptoms experiencing. Also, if there's any coexisting medical conditions. So when you go through and you assess dementia, they do a cognitive test, as we spoke about. So like a mini mental state exam to evaluate memory, language, attention, and problem solving skills. There's also a medical history. Again, they go through the medical records, interview family members about changes in thinking, behavior, function that they may be noticing in themselves or in the individual with a dementia diagnosis. They also will conduct a physical exam. This is to check vital signs, sensory function, and to look for any neurological abnormalities. Lab tests. They order lab tests like vitamin B12, thyroid function, and syphilis screening to rule out other reversible causes of dementia. Neuroimaging, so obtaining a CT or an MRI scan to visualize the brain structure and rule out vascular disease or tumors that may be contributing to symptoms. There's also neuropsych testing. So this is having the individual complete standardized tests that assess multiple cognitive domains to aid diagnoses and gauge severity. There are pharmacological options. Depending on the type of stage, on the type and stage of dementia, healthcare team may prescribe medication aimed at managing symptoms and to potentially slow down cognitive decline. Common medication for dementia include cholinesterase inhibitors and memantine. These medications can help improve cognitive function, memory, and daily function for some individuals. If medication is prescribed, following the recommended dosage and schedule, as well as discussing any side effects or concerns with your healthcare provider, is crucial, especially with an individual with dementia. There also are other antipsychotics. So that can also help manage any psychosis, agitation, or aggression that may manifest within dementia. There's also mood stabilizers that can also help control mood swings and behavioral symptoms of dementia. Cognitive enhancers that can improve alertness, attention, and memory in dementia. There's also antidepressants, so SSRIs like citralopam that can help depression and anxiety that may be associated with dementia. Now, one of the very important things about um, that is very crucial, and it's for anyone, but to manage your medication properly. So, what are some ways that we can help, remind, and adapt for individuals that may have a dementia diagnosis or for someone that is supporting an individual with a dementia diagnosis? So, the first thing you want to do is you want to organize your medications. Using a pill organizer with compartments for each day and time of the week. This can help prevent confusion and ensure that doses are taken on schedule. I use that for myself. Set reminders. So use alarms, timers, or smartphone apps to remind yourself to take your medication at the designated times. I also use that tool. Keep a medication journal. So maintain a journal to record when medications are taken. This can help prevent accidental double dosing and provide a clear record of medication history. You want to use visual clues. So place a calendar or a visual chart in a prominent location that indicates the medications and dosages for each day. Link to routine activities. This is another one that I do. So associate medication times with routine activities like meals or brushing teeth. This can help to establish a consistent schedule. Another one is to seek support from care partners. If the individual does have a care partner, involve them in the medication management process to ensure that the doses are taken correctly. Another one is using medication management apps. Explore smartphone apps specifically designed to manage medication schedules and provide reminders. I also use that tool. Another one is pre-pack of medications. So utilize pre-packaged blister packs or bubble packs that contain medications for each dose. These packs are labeled with the day and the time of administration. You can also involve your healthcare provider. Discuss any concerns or side effects with the healthcare provider promptly. They can provide guidance on how to manage any issues that may arise. The other one you want to do is minimize distractions. So, administer medication in a quiet and comfortable environment to minimize distractions and ensure proper focus. I can relate to this one greatly. I've been doing three different things at one time. I've been taking my medication, unloading my dishwasher, and having a conversation with someone at the same time. And then I stop and I go, uh-oh, did I take my medication for today? And then I have to go back through and I have to count everything to make sure that I am on track. So it is helpful at any stage of the game to minimize those distractions. Another one is keeping medications visible. So that whole out of sight, out of mind thing, this is the opposite. So place those medications in a spot where they're easily seen, such as near a breakfast table or a bathroom mirror. This is another one that I do, and I'm actually guilty. I've got it right beside my coffee station at home. And you really want to regularly review your medications. So, review that medication list with your healthcare provider to ensure that it's up to date and it's still necessary. Avoid complex regimes. So whenever possible, simplify the medication regime to minimize the number of doses taken a day. My dad had this big plethora. It was like he had his own pharmacy. He had like 48 different medications that he needed to take a day because he had scleroderma, and they would all be divided up on the counter to like an AM, a midday, and a PM. So it's just doing those things that just really simplifies the process for you. Another thing that you can do is work with a pharmacist. Your pharmacist is your best go-to person with knowledge when it comes to medications, alternate medications, contraindications, side effects. They are a wealth of knowledge. So remember that consistent and accurate medication management is essential for maintaining health and managing symptoms. Following these strategies can help to ensure that individuals with a dementia diagnosis can take their medications safely and on time. Now, I'm a recreation therapist, so I absolutely love non-pharmacological interventions whenever we can do them. So, beyond medications, the specialist and your healthcare team might recommend non-pharmacological interventions. These could include cognitive stimulation, recreation therapy, physical exercise, occupational therapy, and engaging in social activities, all which can have positive effects on cognitive function and well-being. So when you look at the occupational therapists, they can work with individuals with a dementia diagnosis and their care partners to develop strategies for performing activities of daily living independently and safely. They focus on maximizing functional abilities and adapting routines to suit cognitive changes. Another one is speech therapy. So they can help provide techniques to improve communication skills. So for individuals that may be experiencing communication skills, therapy can be very beneficial. They provide techniques on how to improve communication skills, address issues related to speech, language, and swallowing, which we know that aphasia can be something that can manifest in a dementia diagnosis. So can dysphagia, where it's that challenge and that ability. It's really hard to swallow. So people may need to move to a thickened diet. There's things such as nectar thick, pudding thick. So it's just basically to help that swallowing process. All right, I'm going to get on my soapbox a little bit here and I'm going to talk about recreation therapy. So, how can we use recreation therapy as a non-pharmacological intervention for uh, dementia? So, recreation therapy, also known as therapeutic recreation, offers numerous benefits to individuals that are diagnosed with dementia. It's a specialized form of therapy that focuses on using recreation activities to improve physical, cognitive, emotional, spiritual, and social well-being. Recreation therapy can reduce agitation because you're engaging in enjoyable activities that can improve your mood and reduce agitation. It also promotes socialization. So group activities allow for social interaction and reduce that isolation that may be found within dementia patients. So recreation therapy provides cognitive, mood, and social benefits for dementia individuals as a non-pharmacological intervention. So what do some of these look like? So one of them is cognitive stimulation. I love doing cognitive work with our participants. Anything trivia or anything, if I could stump somebody, I love doing trivia. So engaging in recreation activities that challenge memory, problem solving, and critical thinking can help slow cognitive decline and maintain cognitive abilities for a longer period. Another one is social interaction. Recreation therapy provides opportunities for individuals with dementia to interact with peers and care partners and other members of the community. And research shows that it reduces feelings of isolation and loneliness. And we've spoken before that not everybody's an extrovert and not everyone likes large group activities. But even working with a recreation therapist in groups, you can have a small group of maybe only 3 or 4 people. Everything's adaptable for the person. Another one is emotional well-being. Participating in enjoyable activities can boost mood, alleviate anxiety, and reduce symptoms of depression that's commonly associated with dementia. And there's so much research out there that supports this. Another one is quality of life. I love this life is good mug because it's true. Recreation therapy can really enhance the overall quality of life by promoting feelings of happiness, accomplishment, and satisfaction. Another benefit to recreation therapy is improved physical function. So many recreation activities involve physical movement, which can help maintain that physical function, strength, and flexibility. When we work with individuals in a recreation therapy standpoint, we call it the 5 domains of an individual. So it's social, physical, emotional, cognitive, and spiritual. So, and spiritual necessarily is not a religious practice, but it's that spirituality in connection to earth and grounding and things like that. So we do a lot of chair yoga and things like that, and mindful practice and breathing. Stress reduction. So research has shown that by engaging in recreation activities, it can serve as a distraction from stressors and worries, which therefore promotes relaxation and a sense of well-being. Meaningful engagement. So, recreation therapy focuses on tailoring activities to an individual's interests, abilities, and strengths, which therefore fosters a sense of purpose and engagement because everyone needs purpose. One thing we notice as we get older, we start to lose our purpose. We may be retired, our children may have left the home, and we always look forward to retiring, but then we go, oh, what am I going to do now? So, it's always good to really have that meaningful engagement and really find something that gives yourself purpose. Another one is maintaining independence. So, by participating in activities that encourage decision making and autonomy, individuals with dementia can retain a sense of independence and control. And that's one thing I love about Brella's Day program is we really allow everybody to do independent leisure activities if they so choose to do. So, someone may decide to do a Sudoku puzzle, someone else might do a jigsaw puzzle, someone else may have the choice that they want to sit and just have a nice coffee chat with one of their friends at the day program. And I love things like that because it's that meaningful engagement and it's maintaining that independence. So another thing that recreation therapy can benefit is enhanced communication. So there's opportunities for individuals to not communicate non-verbally, and we do a lot of that in the day program. As I mentioned before, we're this beautiful melting pot of different cultures from all over the world, and individuals in their dementia diagnoses may revert back to their mother tongue, their first language, but we can still find ways to communicate and laugh and have joy. It's amazing and really foster those connections and relationships. There's a pair of ladies that attend the day program, and they are the best of friends. They don't speak each other's language, but they speak non-verbally. They hold hands, they sit beside each other, and they are the best of friends. And it is the most beautiful thing that I've ever experienced because, even without that verbal communication, they have found a way that they just interconnect, and it's quite beautiful to see. They're so happy to see each other each week. Another thing that can help with dementia and therapeutic recreation is having those positive routines. So, by engaging in regular recreation activities, it establishes those positive routines and structure, which can help reduce agitation and definitely improve sleep patterns. Now, this is for the individual with the dementia diagnoses and also their care partner. Another one is recreation really tries to involve family and caregivers. So, by encouraging those shared experiences and by promoting those stronger bonds with individuals with a dementia diagnoses. Non-pharmacological approach. So, as I mentioned, as a recreation therapist, I love non-pharmacological approaches to manage symptoms and improve well-being while also complementing other forms of care. There are instances, of course, you do need the pharmacological options, but this is a beautiful blend of the two. So it's that or that medical model and that person-centered model meshing together. And again, why recreation therapy? It's because it provides a personalized approach. So, recreation therapists tailor the activities and interventions to each individual's interests, preferences, strengths, and abilities. So, therefore, creating a customized and effective therapeutic experience. By incorporating recreation therapy into a care plan for individuals with dementia, it offers a holistic and person centered approach to improving their overall quality of life. It addresses physical, cognitive, emotional, and social aspects, promoting well being and a sense of joy in spite of the challenges that they may be facing with a dementia diagnosis. So clinical trials, depending on an individual's condition and the availability of clinical trials, the healthcare team might discuss the possibility of participating in research studies to explore new treatments and interventions. Participation can contribute to advancing medical knowledge and potentially by providing access to cutting edge therapies. So, pharmaceutical companies and academic institutions are continually conducting clinical trials to evaluate experimental drugs and devices. But there's different trial phases, right? So there's the early phases to test that safety and dosage on small groups. There's also late phase test effectiveness that they do on larger populations. So this is that evidence base and that research to provide the validity that these clinical trials work. There are potential benefits. So there's access to new treatments before they're even widely available, and also additional care and monitoring during the study. So it just adds an extra layer of support and healthcare team that are there to support not only the individual with a dementia diagnosis, but also their care partner. So clinical trials allow individuals to access cutting edge treatments while advancing medical research, which is both. But they do have risks like side effects. So do consider the pros and cons. As with anything, there are side effects with anything, but going into a clinical trial, as with anything, just be really educated, ask a lot of questions, and advocate for yourself. Getting really kind of into the nitty gritty now, one of the most important things to do is to have a care plan. So when you work with your healthcare team, it's important to develop a personalized treatment plan that may include medications, lifestyle changes, and therapies aimed at managing symptoms and slowing the progression of the disease. So together you can create a comprehensive plan that's tailored to the individual's needs and preferences, because that's important. We always talk about individuality, and it's important to meet the needs of that individual. It's also very person-centered. So this plan could include medical management, therapy recommendations, safety precautions, and strategies for managing everyday activities. So one of the things that you want to look at is behavioral interventions. Addressing behavioral symptoms such as agitation, aggression, and sleep disturbances is an important aspect of treatment. As we mentioned, there are non-pharmacological interventions, including behavioral therapy and environmental modifications that can help manage these symptoms effectively. It's not a given that there's going to be behavioral challenges with a dementia diagnosis, but because of the synapses in the brain and the way that the brain is dying, there is a strong probability that that may happen. And that's okay. So when you're looking at creating a care plan, so you want to look at the individual's current care plan if they have one. Um, by going to your general practitioner doesn't necessarily mean that you have a care plan, but this is something that you want to ensure that you develop. So you want to assess individual needs. So look at the physical, the mental, and the emotional that's based on their strengths, their limitations, and their needs. So we always look at the strengths of an individual, and then we look at the limitations, and we look at how that translates into a need. So then therefore we can trade that need and change it into a strength. So you want to develop some goals. So goals are just so important because it's based again on those individuals' needs and priorities, and it makes sure that you are in check to where it is that you are hoping to be. So you also want to choose care interventions. We talked about doing the non-pharmacological, there's assisted therapies, there's assisted devices, there's also pharmacological care interventions. So you want to look at these and make sure that they are specific to the individual and helps to meet their not only their needs, but also their strengths. You also want to go through and you want to identify care partners. So determine family members, friends, or professionals who can assist in care. And this can be challenging because, again, it stems back to that asking for help. So this consultation with the specialist or the healthcare team is an opportunity for you to ask questions, clarify any doubts, and discuss any concerns that you may have. Open communication with the specialist is essential for making informed decisions and coping with the emotional aspects of the disease. So, it's a good way to address uncertainties and explain information in a different way to alleviate concerns. So, they can flip the perspective so that they can help improve understanding and really alleviate those worries. They can outline the progression of dementia and discuss how symptoms may change over time. So, and they can help you walk you through. So then therefore it provides a little bit more knowledge and a little bit more education for you so that, you know, when the disease does progress, because, it will progress between those early, the mid, and the late stages. But they can help you maybe understand that a little bit clearer. They can also explain the results of assessments to determine that severity and stage of dementia that you may be in. So they can explain the results of the cognitive assessments and the evaluations and really just help you have a greater understanding of what the tests that you have gone through. But open communication with the healthcare team is key to addressing any concerns and having the information needed to make really good, strong, informed decisions. So, long term follow up. After your initial consultation, you should expect to have regular follow up appointments with your healthcare team to monitor the progression of the disease, adjust treatment plan and care plan if needed, address any new concerns, assess the effectiveness of the treatments, and make adjustments as needed. The treatment plan should be regularly reviewed, depending on, those changing needs of the individuals and how they're responding to those interventions. This may involve modifying medications, adapting new therapies, or changing those therapies, and addressing new challenges as they arise. So, as I spoke, I am a recreation therapist and we do care plans with individuals. We work with an LPN, so we get that beautiful blend of having the medical model with that person centered model. Um, and, we adapt them all of the time. So, one of the things that we do as recreation therapists is we do a lot of goal setting. So, again, it's that small incremental change to get you to your outcome that you want. So, receiving a dementia diagnosis can be incredibly overwhelming and an emotional experience. And it is normal to feel a range of emotions, including sadness, anger, anxiety, or denial. The one thing is you have to give yourself some grace and be patient with yourself during this incredibly difficult time. And I'm not trying to put a scare factor, but it can be extremely overwhelming because it's the unknown. But, by attending these webinars and doing all of the education that you're doing, you're really helping to enforce and solidify that knowledge. They always say that the more experience and more knowledge you have in something, the less scary that it can seem. So, looking at caring for the care partner, it is so important to support those caregivers because they play such a crucial role in the lives of individuals with a dementia diagnosis. Treatment planning for these individuals should include support and resources, including education about dementia, coping strategies, and respite care options. So, we'll go into a little bit later more techniques that we can do to support that care partner. But, it's really important for that caregiver to find a support group to connect with, especially with others that are going through similar challenges. It really helps to lessen that silo effect and feeling that you're alone and dealing with things that you don't feel that maybe others not experiencing the same thing don't quite understand. It's also important to schedule respite to get regular breaks from caregiving responsibilities. I know a lot of people that are care partners and they feel great. They feel disappointed in themselves because they feel that they need to take a break, but it's exactly like the same thing of being on a plane and where that oxygen masks drops down from the ceiling. They always instruct you to put that mask on first to take care of yourself so that you may help others. And that's exactly what you need to do when you are a care partner. I have somebody in my family that is an amazing care partner and looks after everyone. And she, in the past couple of years, has started taking care of herself. And I'm so very grateful that she is doing that. And she is amazing. And I feel very fortunate to have her in my family because she's an amazing individual. But, like practice that self care. So make time for exercise, healthy eating, sleep, and other self care activities. Again, as a care partner, that can be incredibly challenging. But if you can bring your loved one in with you, maybe when you go for a walk or you can have a nap, maybe like put on funny face masks, just something. And it also really creates that bonding together. Another one you want to try to do is manage stress. I do realize that that's easier said than done, but try relaxation techniques like meditation, yoga, or deep breathing exercises. Another thing that helps for caring for the care partner is to get organized. So, use calendars, to-do lists, and notebooks to stay on top of medical information and care tasks. Because no matter how strong that cognitive reserve is and how strong memory is, when you've got a lot going on, especially if you're in that sandwich generation where you're taking care of a parent and you're also taking care of a child, and let's say you have a partner that has a dementia diagnosis, it can be very easily to just kind of lose track of things, no matter how organized you are. So it's always good to write things down. So advanced care planning. Using as dementia progresses, it's important to discuss and document preferences for medical care and end of life decisions. Advanced care planning ensures that the individual's wishes are respected and communicated to healthcare providers and also for family members. So, have those open and honest conversations with loved ones about preferences for medical interventions and end of life care as dementia progresses. It's not an easy conversation. I remember having this conversation with my mom, and, it wasn't something that she wanted to talk about, but it's necessary. Like at any stage of your life, it's good to have your preferences known, and document your decisions. So formally document them in an advance directive so that you can share those with healthcare providers. So that way you have a voice when you may no longer have a voice. And you also want to review it periodically. As your illness progresses, you want to make sure that they still um, align with your current preferences, and this can be challenging. So this is why your support system can really help you with this, because if you get into the mid and the late stages and you're having a little bit of a challenge in making those informed decisions, that by having those open and honest conversations with loved ones, they can assist and make sure that your wishes are being communicated and respected. So it's a hard thing to talk about, but you got to look at planning for the future. So there are some things, so early planning for care options allows time to research and make the best choices based on individual needs and preferences as dementia diagnosis progresses. So, use that knowledge to plan for this future. Consider options such as home care. There are things where you can bring in home health aides, personal care aides, or companions to provide assistance and supervision with daily activities, medication management, meals, and respite for caregivers. There's lots of privatized organizations out there that do provide this. There is also home health through whichever health authority that you are associated with. Can also provide some personal care aides to come in. Organizations such as Brella, we have volunteer programs where companions can come in and for assistance and take you to appointments, help you out with meals, and also to make a new friend. Another option is assisted living or adult day programs. So as I mentioned, I am part of one of the adult day programs at Brella, and I think that it is an amazing program. It's interesting because when people come in at first, they're a little apprehensive and they're like, is this a daycare? Am I coming to school? Like, what exactly is this? And I always ask them to give us at least a month of attending to see if they love the day program. And it's interesting. It's always the people that are the most resistant that no, this is not for me. I don't have any desire to attend this adult daycare. And they're always the ones that request more days and they don't want to go home at the end of the day. And I love that. I absolutely love that. And they just get engaged with everybody else. So these, for the early to middle stages of dementia, these assisted living or adult day programs can help with daily activities, meals, transportation, and social interaction, which allows for independence for not only the individual with the dementia diagnosis, but also for their care partner. It gives that little bit of that respite break. There's also memory care facilities. So that it's got for moderate to severe dementia. So memory care facilities offer 24-hour, 7-day-a-week care with assistance of daily living, secure spaces to prevent wandering, and tailored activities. When you look at the memory care facility and you see the moderate to severe and the 247 care, it seems intimidating. But there are a lot of really good facilities out there. There's one that's tailored especially to the severe stages of dementia, and that's called Chorney. They also have a day program, and it's quite specialized because they only have 15 clients that they support at a time. So again, that early planning for care options allows that time to research and make the best choice based on individual needs and preferences. Because again, it may not be everybody's thing. A day program is not everybody's thing, and that's understandable. And assisted living may not be everybody's thing, but you want to find the thing that works for you, what works best for yourself with the dementia diagnoses, and also when you are a care partner. Big thing about treatment planning is emotional support because we really need to encompass that emotional well-being. So mental health services, access to counseling, therapy, support groups, mental health services can greatly help individuals and also their families cope with the emotional impact that comes with the dementia diagnosis, because there is an impact. No matter how educated you are, it's like anything else. When you get a diagnosis of you've got a diabetic diagnosis, or you've got high blood pressure, or you've got high cholesterol, it's the same thing. It's a bit of a shock. You kind of and then you think to yourself, okay, now what? So the emotional support is really beneficial. And we got to remember that every individual's journey with dementia is completely unique, and the treatment plan, again, it needs to be tailored to their specific needs, preferences, and circumstances. Not everyone may want to go this route of emotional support. They may not be into counseling, therapy, support groups, anything like that. But it's an instance of finding the thing that works for you. Not talk therapy may not work for everybody. Sometimes it's more just being in a group of others and just having that support. And with the pandemic, there was the not great things that came out of it, but there's also some very great things that came out of it. And one of them is that a lot of services have moved on to virtually. So if mobility is an issue, then by attending those support groups or counseling or mental health services virtually can be very, very useful. So regular communication with your healthcare team, along with flexibility in adjusting the plan as necessary, is key to ensuring the best possible quality of life for individuals that are living with a dementia diagnosis. Okay, so let's talk about support systems. These are hard because, again, this is asking for help. So how do you go about creating a support system around you? So by building a support network of family members, friends, and care partners who can provide you emotional support and assistance with daily tasks and also companionships. So what do you want to do? You want to identify your needs. So determine what kind of support you require, such as emotional, physical, or social, and jot it down. Then you want to assess your relationships. So evaluate your existing relationships with family members, friends, and care partners. Identify those who are most likely to be understanding, empathetic, and that can provide that support that you need. Communicate openly. Having those honest conversations about your needs and how supporters can help are crucial. So reaching out about your desire and your needs to build a support network. And it's tough, but be honest what you're going through and how they could potentially help. I know the big question is always, how can I help? And sometimes when you're in the nitty gritty and in the deep of it, you can't even put any thought into, oh my goodness, how can they help? You just want the help. And you also want to involve multiple sources, build a network of supporters to access different types of help. So, like mentioned, like friend, family members, healthcare workers, advocates, resources such as us. So really try and build that network around you. And you want to set that expectation. You want to clearly communicate your expectations and boundaries to avoid any misunderstandings. This can include how often you'd like to communicate or how much time you would like to spend together. Communication is key to avoid any misunderstandings. Again, you want to diversify your network. So have a broad mix of people. This way you can have different types of support from various sources. Another one is you want to nurture those relationships. So regularly invest time and effort into maintaining these relationships. Reach out to the people that are in your support network, check in on them, and show that you care about their well being too. Be open to reciprocity. So support goes both ways. They work best when they're mutually beneficial. So be open to reciprocating support and being there for your network members when they need it as well. More steps. So you want to plan activities. So arrange activities that promote bonding and companionship, such as spending quality time together, engaging in hobbies, or participating in group activities. And utilizing technology. My gosh, in today's digital age, technology can help maintain connections even if you physically can't be present. So use video calls, messaging apps, and social media to stay in touch. Professional help. So while friends and family can provide amazing and valuable support, don't hesitate to seek support help if you need it. Therapists and counselors and support groups can offer a more specialized assistance if needed. Another one is expressing gratitude. So gratitude goes a long, long way in maintaining strong relationships. So show appreciation for the support your network provides. A simple thank you or a small gesture can go a really long way in maintaining those strong relationships. Adapt. So what is the dictionary definition of adapt? So it's a verb and it's to make something suitable for new use or purpose, to modify. So become adjusted to new conditions. So life changes and so do your needs and your circumstances. Periodically reassess your support system and make adjustments as necessary. Remember that building a support network takes time and effort, but by having a strong group of people around you can greatly enhance your emotional well-being and quality of life. Legal and financial planning. Now, I am not a lawyer, but I did some research. And so creating important legal documents can provide you and your loved ones with peace of mind if you receive a dementia diagnosis. And I mean, it's never too early or too late to start that legal and financial planning. So one thing that you want to do is you want to understand the importance of legal and financial planning early on. So early planning can help ensure that your wishes are honored and your affairs are properly managed. This includes creating legal documents such as power of attorney, living wills, or trusts that ensure that an individual's wishes are respected as the disease progresses. So consider meeting with a legal professional to create or update important documents. Seek the guidance of an attorney that may be experienced in elder law or estate planning. They can provide tailored advice based on your specific situation and the laws of your jurisdiction. So by creating or updating, if you don't already have it, your important documents, so a will, draft or update your will to ensure that your assets are distributed according to your wishes. Create a power of attorney or a POA. So designate someone you trust to make financial and legal decisions on your behalf if you're unable to do so. This can include managing your finances, property, and other legal matters. Advanced directives. So you want to create documents that outline your healthcare preferences, such as a living will, which is end of life medical care instructions, and a healthcare proxy. This is appointing someone to make medical decisions for you in the event that you are not able. You want to consider your trusts. So depending on your financial situation, you may want to consider setting up a trust. So trusts can help manage assets and ensure whether they're used for your benefit. And ensure they are used for your benefit as you navigate the challenges of dementia. You also want to review your finances. So compile a comprehensive list of financial accounts, assets, debits, and any insurance policies. This will be invaluable to your caregivers and family members. You also want to address long-term care costs. Got it in here somewhere. But you want to address long-term care costs. So you want to research and plan for the potential costs of long-term care. This might involve home care, assisted living, or memory care facilities, which I just spoke about. So financial planning can help ensure that you have the resources that to cover these expenses. You also want to review beneficiary designations. So ensure your beneficiary designation on life insurance policies, retirement accounts, and other assets are up to date and reflect your wishes, because those can change over time. The other thing you want to do is you want to address your digital assets. So consider what will happen to your digital assets and decide how you'd like them managed. So what are digital assets? Online accounts, social media profiles, etc. So make a decision and document what you would like to happen with those and how you'd like them to be managed. So proper financial and legal planning can ensure that resources are available as dementia progresses. I know that we have a tendency to be like, oh, well, deal with that when the time comes. I will deal with that when the time comes. It's never too early, because when the time comes, it's amazing with all of the things that you are incredibly overwhelmed with that you thought that you would have time to plan out. Guard yourself against financial exploitation. Discuss strategies to protect yourself from financial exploitation or scams that often target vulnerable individuals. There is some really good scams going out there right now, and they look so legitimate. But you really want to review and update your situation as it evolves, review your legal and financial plans periodically to ensure that they remain aligned with your wishes. Legal and financial planning during a dementia diagnosis is all about ensuring that your wishes are respected, safeguarding your assets, and easing the burden on your loved ones. Again, a legal, experienced professional can provide personal advice and help you navigate this complex process. So I wanted to share some support resources out there, because there's a plethora of resources out there. There's so many, but it's really hard sometimes to find the exact resource that you're looking for. So again, if there's at any time that we can ever assist you in finding a resource for a specialized anything that you're looking for, please reach out to us. But I just wanted to provide a couple of them. So one of them is the Alzheimer's Society of Canada. So it's a national not-for-profit that provides support, information, and education programs for people living with dementia, their caregivers, and healthcare professionals. They've got all sorts of different resources on there, and they also have provincial divisions. So there's an Alzheimer's Society of BC, Alzheimer's Society of the Yukon, et cetera, et cetera. Another good one that is if you're looking for information, and especially if you're looking for research. So this is the Canadian Dementia Learning and Resource Network. So it's the CDLRN. This is a knowledge hub that facilitates collaboration between community-based projects across Canada and amplifies their successes. So that is a project that they did under the Public Health Authority of Canada, which this is what this project is funded under. And we're going to reach out to them to have that collaboration so that we can amplify the success of this project. So if you're ever looking for something that they've done or resources, anything like that, that is a really good knowledge hub to check into. Another one is the Canadian Dementia Resource and Knowledge Exchange. So this is CDRAKE. So this provides evidence-based information and resources on dementia prevention, treatment, and care. Again, this is another one. It's got really, really good resource and knowledge exchange, knowledge transition, things like that. The Government of Canada is another one under the public health. They've got quite an extensive dementia section where you can drill in, and they've got little videos and infographics that can sometimes help, because, learning happens in many different ways. So when you're looking for information and support, you really want to look at the reliable sources of information, such as the online forums, books, educational materials, journal articles, things like that. But, you don't want to depend on something like Wikipedia as like a really good, strong support. You want to have something that is research-based and evidence-based as well. There are many supports available. Now, this slide is a little bit overwhelming because there's a lot of stuff on there, but I just wanted to touch on the things and the people and the supports that are available for an individual with a dementia diagnosis or a care partner or an advocate or community member. So family doctors and primary care. So family doctors can provide that initial diagnosis, the ongoing medical care, and referrals to specialists if needed. Now, here in Canada, you need to advocate very, very strongly, especially if you want a referral to a specialist. But your family physician plays a crucial role in managing your overall health and well-being. There's specialized memory clinics. I made reference to Chorney. There's also day programs that are therapeutic recreation based that really focus on cognition and memory. So, these clinics offer specialized assessment and management of memory related conditions that also include dementia, because memory clinics also address many other conditions, anything that has to do with the brain and memory. But they can provide comprehensive evaluations, diagnoses, and recommendations for care and support. Community care services. So again, home care service offers assistance with daily activities such as bathing, dressing, and medication management. These services can help individuals with a dementia diagnosis continue to live safely at home. There's also day programs and respite care. So day programs provide a structured environment where individuals with dementia or any other health condition, or even just if you want to join for socialization, but it allows individuals to be able to participate in activities while giving that care partner a break. So respite care offers that temporary relief for caregivers. And I know that there's a lot of guilt in caregivers that they feel that they're abandoning their loved one. But again, it's that whole, you got to fill your own cup before you can help anybody else. There's also long-term care facilities. For those with an advanced dementia, long-term care facilities provide 24/7 support, medical care, and activities in a secure environment. So everything is dementia inclusive and dementia and friendly on that neighborhood where your loved one may live. There's also support groups and education. So, support groups connect individuals with dementia and their care partners so that you can share lived experiences, advice, and also provide each other with some emotional support. And educational programs can provide that greater information about dementia management to help you get a greater understanding of some of the symptoms that yourself may be experiencing, or if you are a care partner, what that looks like, so that you can further provide that good strengths-based support for your individual. So there's caregiver support. So there's programs and resources. Brella actually has a caregiver support group, and these are available to provide caregivers with information, training, counseling, and support to manage the challenges of caring for someone with dementia. Just because we're a care partner does not mean that we're adequately equipped to, support an individual that may be having a dementia diagnosis. Therefore, that's why it's always beneficial, especially when you're attending things like this, webinars, readings, journal articles, to really kind of help peel back the layers of the onion. We always talk about you need to be a dementia detective and look at why are these things happening? Because, especially when you start to lose communication, if someone is having a behavioral response, it doesn't necessarily mean that they are angry or, they could be upset. They could be thirsty. They may be hungry. Maybe they need to have a bio break. Maybe they are uncomfortable and they've got a pressure sore and, they've lost that ability to be able to sort out and communicate what is going on. But it can really help, identify and lessen some of the stress that the care partner may be experiencing when they're supporting someone that may be having new behaviors or symptoms that they've not ever experienced before. There's also assistive devices. So these can come in great handy to enhance independence and safety, such as mobility aids like four-wheeled walkers, home modifications, and communication tools. So what are the things that you need to do in order to keep your loved one safe and upright while still living at home? Medication and treatment. Healthcare professionals can prescribe the medications to help manage those symptoms and slow the progression of certain types of dementia. just reiterating kind of what we spoke about before. So access to therapies, again, we were speaking about occupational therapy, recreation therapy, physiotherapy, speech therapy. These can all be beneficial for managing cognitive, physical, and communication challenges that may be associated with dementia. But you yourself, you will know on what the right therapy is available for you and is most suitable for you. And again, you can always consult with your healthcare team to get those recommendations because they've done that assessment on you and they can provide you with the best therapy available for you. There's also hospice and palliative care. So as the disease progresses, hospice and palliative care services offer support for individuals with advanced dementia and their families while focusing on comfort and quality of life. It's important to note that the availability and specifics of these options may vary depending on the province or territory within Canada, and it may look different in other nations across the world. So by accessing these services, it involves coordination amongst healthcare professionals, caregivers, and community organizations to create a comprehensive and personalized care plan for individuals with dementia. So I just want to briefly talk on, so your partner has received a dementia diagnosis, now what? Receiving a dementia diagnosis can be challenging for both the person diagnosed, their partner, and their families. So just some steps that you can take. So, you want to educate yourself, learn as much as you possibly can about dementia, its symptoms, its progression, and available treatments. By understanding the condition, it can help you support your partner and better prepare for the future. Communication and emotional support. Again, open and honest communication is crucial. It's hard, but it's so crucial. You want to create that safe space where your partner can express their feelings and concerns. Be patient, compassionate, empathetic, and listen actively. Offer emotional support and reassure them that you're there for them. You want to involve medical professionals. So, make sure you attend your doctor's appointments with your partner to gain a better understanding of their condition and treatment options. Ask questions, seek clarification, advocate if necessary, and actively engage in discussions and care plans. Another thing that you can do is, again, seek out those support networks, connect with support groups, organizations such as here at Vrella, online communities that cater to individuals living with dementia and their care partners. These networks can be so beneficial by providing that valuable information, guidance, and support. Take care of yourself. Prioritize your self-care through respite care, hobbies, and a strong support system. I do realize that this is easier said than done, but caring for someone with dementia or any other condition can be emotionally and physically demanding. It's important to prioritize your own well-being. Seek respite care, lean on your support network, and engage in self-care activities that can help you recharge and maintain your own mental and physical health and well-being. You want to maintain a routine and adapt it as needed. So establishing a routine can help provide structure and stability for not only yourself, but also your partner. As the disease progresses, be prepared to adapt the routine and make necessary adjustments to accommodate their changing needs. Remember that caring for someone with dementia is a journey that requires patience, understanding, and flexibility. So please don't hesitate to reach out for support and seek professional guidance if and when needed. So we get asked this all the time. How can, I have a dementia diagnosis. I can't do the things that I used to do. Or my partner has a dementia diagnosis and they can no longer do the same things that they can do. Au contraire, they can do everything that they used to be able to do. You just need to modify it. So here are just some tips and ways that you can stay socially active with a dementia diagnosis. So you want to stay socially active, encourage engagement in social activities and hobbies that maintain social connections and mental stimulation. So again, by staying socially active, it's important to maintain that sense of connection and mental stimulation, especially with an individual diagnosed with dementia. So again, what can I do still with a dementia diagnosis? My question to you is, what can you not do no longer because of a dementia diagnosis? The world is your oyster. So, you want to join those support groups if that is something that is beneficial for you. You want to attend community events, look for local events, workshops, gatherings. This allows for interactions with neighbors and the community. You want to stay in touch with family and friends. Maintain that regular communication with friends, family members through phone calls, video chats, and visits. Participate in group activities. Join clubs, classes, or hobby groups that align with your personal interests. This provides an opportunity to bond with others who share the similar passions as you. Another one is volunteering. So, explore volunteer opportunities in the community by contributing to a cause can provide a enormous sense of purpose and social engagement. Attend recreation centers, visit local, I've got senior centers there, but it should be just local recreation centers that offer activities like arts and crafts, exercise classes, and social events. These promote interactions among older adults. Explore creative activities. So engage in creative activities like painting, music, writing, or crafts. These can be enjoyed individually or in groups. One of the things that I get very commonly is, Kim, I am not creative. I do not have a creative bone in my body. So then I bring it back to, do you schedule appointments? Do you make lists? Do you organize things in a certain way? And I got, well, of course I do. And I was like, then that means that you're creative because you have the creative brain to peel back those layers and make those lists and sort that kind of thing. So everybody has a creative bone in their body. It doesn't always mean that it's painting or arts and crafts or anything like that. Another one is exercise classes. We know that exercise promotes physical health and opportunities to socialize. And it also, misery loves company. So you can sit there and commiserate with each other. Why are we doing this cardio? Okay, we still only got 20 minutes left. And that's the biggest thing, is a lot of the time it's the mind over the matter. Engage in memory cafes. Memory cafes are specifically designed for individuals with dementia and their caregivers. They provide a really safe and supportive environment for socialization. Use technology, explore social media, video calls, and messaging apps to stay connected with friends and family members who may be physically distant. And you want to attend cultural or religious activities. So participate in cultural or religious events, services, gatherings. This can really provide a sense of community and spiritual connection. You want to participate with younger generations. So engage in those intergenerational activities like reading to children, participating in school programs, have them come into your home, go on a walk with each other. There's so many different opportunities, and it just really is fantastic to share that knowledge so that, dementia isn't a scary diagnosis, and it just helps open and broaden the minds of those younger generations. Participate in outdoor activities. So things like gardening, nature walks, going for picnics, just standing outside in the grass and just planting your feet in the grass and feeling connected with earth, and just closing your eyes and taking a big breath in and listen to the sounds around you. Do you hear birds? Do you see bees? Do you hear laughter? Visit libraries or museums. These are things that are very low cost. But libraries and museums offer lots of events and programs that also encourage social interaction and cognitive stimulation. And the last thing that I want to leave you with is stay involved with your hobbies. So continue to pursue hobbies and interests that provide enjoyment and opportunities for interaction. But one of the first things that we do is, when we get busy, is we let go of the things that we enjoy, right? So we let go of those therapeutic interventions and activities that we know are so beneficial for our health and well-being. And the first thing that we do, oh, I'm too busy, I'm too overwhelmed, I'm supporting someone with a dementia diagnosis, or I have dementia, I can no longer. I have heard that so many times, I can no longer. So then my next question to you is, why can you no longer? What does that barrier look like for you? I bet you we can push that barrier down. So the one thing is, just if you have any hobbies, please continue to pursue them, because those hobbies will stick with you as you age. And it really, really helps to contribute to that cognitive reserve that we were speaking to. So by encouraging social engagement and participation in activities tailored to personal interests that can help individuals with a dementia diagnosis maintain their social connections, boost their cognitive function, and enhance their overall quality of life. Why? Because at the end of the day, I'm still me. I hope this content wasn't too heavy, and I do hope that it left you with a little bit of hope, because there is hope in absolutely everything that we do. Thank you so much for joining us today. We'll see you next week. Bye.